Good afternoon and welcome to the Care First webinar. We're going to look this afternoon at how to support people from home. I'm so sorry, I'm mindful that something is flashing up on the screen about attendees needing to get on. Please bear with me. It's just going to keep happening for now. So we'll go through this the best we can. I'm so sorry, guys. Okay. My name is Pat Garland-Smith and I'm the training manager at Care First. Many of you will have done your 2-day mental health first aid course with me, so it's nice to be back in touch with some of you, and hopefully we can get something out of this, providing we can see the screen, of course. It seems to be going on and there doesn't seem to be too much I can do about it. Okay, don't worry, there will be a copy of the slides available should you need them after this, because we've got clearly an issue here with the large number of people wishing to attend. Okay, so back in March this year, Mental Health First Aid reached out to many of its instructors and mental health first aiders to ask to help cope and join in the national attempt really to help people during this coronavirus. It's really been an important and difficult time really. It was felt that because of the virus, people's stress, anxiety and depression was going to be heightened as a result of this. Added to that, the social isolation, which is going to make it really, really difficult for people to manage. And it was hoped that mental health first aiders could actually help and support with this. So just going back really and looking at the role of the mental health first aider in the workplace, it really is to be a point of contact for that person, that employee who may be struggling with mental health issues. It could be that initial contact, it could be just that initial upset, but it's clearly a distressing time for people, and your role is to help and support them in that difficult time. To be a point of contact actually during the crisis, and to help someone who may be developing any mental health issue, and to point them, signpost them into the right and appropriate service for them. One of the things you need to remember is that you need to be accessible. So since your training, what has your organisation done to help promote the role of the mental health first aid post? Remember, we talked about where your role would sit within the organisation and where the advertising of your roles would go, where it would look. Would people know how to contact you? And if so, is that still appropriate? How has your role been advertised? And right now, I think we need to consider very carefully in this current situation, do you want people to have your contact details? And I'm meaning that because we're all in a very different world right now. We're all living in an isolated society where we're not having social contact with people. It might be affecting us as mental health first aiders adversely. We could be struggling with it personally. Alternatively, we could be surviving it. In fact, some of us may even be thriving with it. So I think right now it's important to look at your own mental health and well-being and ask yourself, do I feel okay enough to actually have people contacting me right now? I'm going to apologise again, guys, because this thing keeps flashing up, and whatever we do, we can't get rid of it. So please bear with me. I will make the slides accessible to you. Remember, what you do as mental health first aiders has a profound impact on your community. It's not just for family and friends or for yourself, but for people in the workplace. Remember also that it's safe. It's a robust and evidence-based model of working. It helps you be quite confident of the intervention you're making, having been tried and tested. One of the things you have to do is to keep yourself well and healthy, and also to make sure that you have the right information in terms of yourself and your own self needs here. You have to be able to communicate any concerns about mental health and well-being of anyone in your workplace, for example, to an appropriate manager. And you have to be able to do that whilst holding and maintaining that boundary of confidence there. You also have to be able to follow your workplace policies and procedures on how mental health first aid is implemented in your workplace. Part of your responsibilities also is to uphold your role as a mental health first aider in terms of your own well-being, alongside your other responsibilities. Many of you will have much more to do than being just a mental health first aider. And being a mental health first aider and a listener can impact on those responsibilities. So you have to be mindful of making the time to be able to do that. You have to be able to establish that appropriate boundaries between yourself and any colleagues that you may be supporting. And really, we've heard from mental health first aid that we have to have refresher skills every 3 years, just to keep ourselves on top of the game and on top of the changing society of mental health and mental health first aid. So, how are we going to manage people when we're working remotely and they're working remotely? Well, I guess, do you remember we watched the video about Rick, who suffered from anxiety? And he was saying that he didn't know when it was going to come. And he was in that place for a very long time. But over a period of years, he learned to recognize when he was going to be struggling again. And he talks about kicking the door down and something landing straight on top of him, and it sits right on top of him. And that's when he knows he's in it. And when he's out of it, he doesn't realize how bad it's been. So I think one of the tips for us as mental health first aiders is to think about, do we have any concerns for someone before the pandemic started? And if we did, what have we done about those concerns during lockdown? Have we contacted them? Have we allowed them to contact us? How have we contacted them? So it really is important that we know how to do this. And I think what we have to consider here as well is not just that, but saying what we need to do is get a plan, a bit like Rick. So when he's well, he's got this plan of what to do when he gets unwell. Same for us as mental health first aiders. We need a plan, and we need to know people in a way before they get ill, so that we know when they're getting ill again or when they're needing our help. You have to consider how online workers are going to approach you. Are you going to be contactable? Are you going to be easy to get in touch with digitally? And goodness me, seeing all this thing flashing up on the screen now, it's a test on every level, isn't it, really, for people? So how confident are you? How confident with you are you about contacting them digitally? How confident are they speaking to you in that format? I guess those are things that, you know, we have to find out. Think about your colleagues. Think about how your colleagues know who their mental health first aider is. Now, I know with some of the organisations I've been involved with training, we've done a launch there within that organisation. I've come on site, we've worked with you, and you've done very mini workshops for people so that they know who their mental health first aiders are. Some people have set up WhatsApp groups, some people have lists, and some people have like almost like a duty rota. So when they feel okay enough to be on that list for mental health support, they're there. And when they're not, they're off that list. So how will your people know where you are and who you are? When you contact colleagues right now, it's remember to show them in some way that you are a mental health first aider. Now, I know many of you at your signature, email signature, will have the little MHFA badge there that goes along with every email. However, you can also download a digital poster and send it with an email so that people know who you are. Some of the other tips around supporting people remotely is you need to apply exactly the same principles as sitting down in front of the person when you're having a video, a Skype or a Zoom call, just the same as an in-person conversation. So what we have to remember is to set time aside. Do I have time to talk to that person right now? Am I in the middle of a report or something that I have to give priority to? How am I going to manage that to set that time aside? I need to minimize the distractions, and never before has it been more challenging. Some people don't have a study. Some people are working from a dining room table. Some people are working in the kitchen or perhaps a spare bedroom. There are lots of interruptions within the normal day-to-day running of the household, particularly as we have children at home now as well. It's an added dimension to how on earth we're going to manage at home talking to people in a calm and measured way. So wherever possible, minimize those distractions. Give your full time and attention to the person. If they're contacting you by telephone, your listening skills are going to have to be really, really sharp, because you won't have those facial expressions. You won't see if someone's crying. You won't see if someone's angry. All you'll be able to do is hear. So you can say things like, you know, I can hear you're struggling with this. I can hear that you're upset, and you need to know that I'm here to support you. You also need to make clear to that person that you are there to support the person remotely if that's what they want. Now, if they can use Skype or Zoom, then obviously you can see them and you can have a different interaction. But if it's done over the telephone, remember all those things we've talked about. Remind the person about speaking with their own manager if possible. Give them the confidence to do that. Enable them if they're struggling to say, how can I help you? Talk with your manager without me doing it for you. What skills do you need to be able to do that? How can I, as your mental health first aider, help you with that? What do I need to do to make this easier for you? And what can you do? Have the information to hand about their counselling provision. Care First. Make sure you have with you a copy of the leaflet and the card. You can actually request those in terms of an electronic copy while you're working remotely. So you can have an electronic copy to send out to staff who may need support. You need to remind them that we're there, and most importantly, to know what we actually do. Try and offer them some self-care tips they can do from their home. So remind them about eating healthily, remind them about drinking adequately in terms of getting fluid hydration into them, remind them about the downfalls of drugs and alcohol. Try and encourage them to get some exercise. So what in fact you're doing is a mini version here of the algae model. You are actually giving them some support, you are actually giving them some information, but you're also encouraging them to think about what they can do to take back some control. And do you remember the frame of reference? Those of you who trained with me will actually remember that this is my favourite part of the course. And we talked, didn't we, about how our window on the world is affected by all the things that are happening around us. Well, right now, that window on the world is pretty much the same for everybody. We are part of a global pandemic. This is happening worldwide. So everybody out there are experiencing things in a similar way to us. And when we return to whatever normality may be, the frame of reference will forever be different. It will always be different for people. And I think as it's different for us and will be different for us, it's going to be different for other people. So please remember not to assume that they're coming from the same reference as us. What they will have in common is the lockdown. What they will have in common is all of the news around COVID. What they will have in common is the anxieties associated with it. So we will share that frame of reference going forward, but forever going forward, the frame of reference will have been altered because things are unlikely to ever go back to the way they've been. So do you remember the 5 steps? I'm sure you all do. I'm sure it's all ingrained on your memory. Approach, assess, assist. You're looking for crisis, aren't you? You're listening non-judgmentally. You're giving support in the moment. You're encouraging professional help. And finally, you're encouraging the person to take some action for themselves. What can they do to keep themselves healthy? So we've come up with another model here that is also based on algae, and it's the same principle, and it looks like this. So the A is, are you easy to get in touch with? You're looking at your listening skills. This is going to be different. Yeah, you may not have facial expressions to look at if you're doing this over the telephone. If you are and you use video, then you can still listen and you will still have that visual communication with people, that visual clue. But essentially, you're going to have to listen carefully and listen differently because people are presenting with different sorts of issues now. And a lot of it is related to loss and bereavement. A lot of it is related to fear and anxiety. What might happen if this is me? There are lots of people with very serious concerns here. But also, it's not all gloom and doom. Some people in this pandemic are actually thriving. Some people like this new world. So again, remember the model of the world, the way we see the world will be different, and the model in which we work will be different. So exactly the same way as giving support when you're with the person, we give support remotely, in the moment. What's helping you while you're at home? How are you coping at home? What support is there for you within your home? Are you able to Skype friends and family members? Are you able to in touch that way? And then when you go on to encourage, perhaps encourage professional help and be aware of what that help actually is. Now, it's no good saying, oh, well, pop and see the GP, because that's no longer possible. People now are being invited to go into their surgeries. They're being triaged. They're having a telephone conversation with the GP first. And if the GP thinks it's serious enough, they invite the person into the surgery. There's no more drop-in or walk-in. And so that's very different. So when you're encouraging the professional support, be aware of the way it's working. In the back of your manual, that good old manual that I've spent some time looking for, and then realized actually it's sitting underneath my laptop, holding the laptop up. So I always told it would be useful for something. So that manual at the back, there's masses of resources there, masses of national helplines there that you can get numbers for, give them out. Remember, we talked about testing them first. Test some of those numbers, make sure the people are still available. There's a huge increase at the moment in terms of domestic abuse. Make sure you have the telephone helplines for that. Remind them of the professional help that Care First can give. Care First is here in exactly the same way. Remember how to contact us. Remember that you can contact us also. And finally, the E, talk to the remote worker to find out what currently supports them and give them guidance about how to support their mental well-being at home. And that's the things we've already said. The diet, the hour of exercise a day, going out into the garden if they can, the things to keep them occupied, to keep busy, to keep active, to regain that sense of purpose. Anything that you can do to encourage that worker to take some responsibility. Remember the issues if people are already suffering or living with a mental illness and are already taking medication. This is not the time to resort to alcohol or drugs. This is only going to exacerbate the situation, as we've said before. Because what we're working towards is a healthy community. Now, that sounds a bit ironic in this time, but we are actually working toward that. How are we going to do it? We're going to look at the roots there. We're going to look at permanence. How permanent is this going to be? What is the permanence going forward? What does that actually mean there? We're looking at reflection, resilience, and community. Now, those of you that have been standing on the doorstep on a Thursday night clapping to support the NHS frontline workers, there's a huge sense of community when that's happening. It's not just somebody out there solitarily standing there and clapping. There's a whole community behind you there. And from that comes hopefulness. Remember when we were doing our course, we talked about even the most serious mental illness, one can be hopeful of a recovery or of some degree of recovery. Well, this is exactly the same here. We've got the bark of the tree, that's the hopefulness. And from that hopefulness is going to come improved self-belief. I can cope in really difficult situations. I do have empathy for people that might be going through something similar to myself right now. I do have a greater self-awareness. I know now what works for me. Perhaps I wasn't aware of that before. Other people may see the same. Love is an important thing there. It looks at actually who are those people, our loved ones, that we're not able to see. Hopefully we'll be able to see them again, hence the hopefulness. Relationships, how are they? Confidence, responsibility, and kindness. We can at least be kind. So it's all those things that we're looking at and thinking about here. So what waters that is the algae model. You see a little watering can there? The watering can, the stuff that goes onto the roots, is the algae model. The approach, the assess, the assist, the listen, the give, the encourage professional support and help, and to encourage the individual to cope for themselves. So with that watering going on to those roots, the hopefulness grows, and so the buds at the top of that community can start to grow. So remember the tips again. When working from home, make sure you're contactable. Make sure you want to be contacted. Make sure you're well enough yourself, emotionally and physically robust enough to do what could be quite a challenging thing at the moment. Be aware that you're in different surroundings to offer help, as are they. Be aware of the distractions in the household. Remember to set time aside exactly as you would if you were going to see them face to face. Remember that people can contact you by Skype or by Zoom or however it is they want to do that, and you will at least see that person. But if you can't do that, remember the telephone. Remember to add your little MHFA logo to the bottom of your emails. Ask Care First for a digital copy, electronic copy of the marketing material we send out at Care First, and you can send people a Care First leaflet. Remember also that the counsellors are there for you as mental health first aiders. You can phone up in your own right as a mental health first aider and say, I've been talking to someone, I'm a bit concerned about them, and I just want some support for myself right now. And people at Care First are available to help and support with that. So think about all those things. Think of all those things we looked at on the courses that we did together. Think of the back of your manual. Never before has the back of that manual been so helpful in terms of resources. Look at the stuff in there on self-care. Remind yourself of that frame of reference, and then think about, how am I going to set up a meeting with people? What am I going to do? This is all very different. Work through those categories in exactly the same way as we did on the course. How are you going to sit? Where are you going to sit? What about the opening questions? What about the open questions you use? How are you going to clarify what people are saying? And remember in all of this, that risk question. Remember that suicide question, which is hard for many people to ask. When they say they're not coping, they can't go on, just ask, what exactly do you mean when you say that? You're listening there, remember, for signs of crisis. And finally, remember that Care First is there. We remain available for you for 24/7 contact, for telephone counselling and support, for contracted telephone counselling, for the information services, for management support and advice, and for telephone-only critical incident support. The only thing that's changed at the moment is that we aren't offering any face-to-face counselling, but you can still contact us 24/7, and people are using the service massively at the moment, as I'm sure you can imagine. You can help with that. You can help in your role as a mental health first aider to actually help and support people in your community, remembering it's a robust and evidence-based model that you're using. And finally, remember the Care First number. Now, I haven't put it on there because it's different for different organisations, but find out in your organisation what is the Care First number that your people need to call on, and make sure that the people you're speaking with get hold of that number. Look after yourselves. Remember, it's important to be okay yourself first. Refer to your manuals. Take an hour or so just to have a look at that and see how you can help. Just remember the resources at the back of the book. Take care, stay safe, and stay well. Thank you.